Health Minister firm on NHI plans amid political uncertainty and medical aid restructuring in South Africa, by Satori News. South Africa's commitment to universal health care through its national health insurance NHI is a subject of national debate, intensified by the recent political shifts and the concerns of various stakeholders within the health sector. Health Minister Aaron Motsoaledi, in an interview with Bekasisa, confidently addressed the myriad of concerns swirling around the NHI and the future of private healthcare funding in the country. Notably, Motsoaledi dismissed the alarmist projections of the NHI costing South Africa over R1 trillion, labeling such claims as garbage. His steadfast attitude is reflected in the government's approach to the legislation that restricts the current operations of private medical aids. Following the 2024 elections, South Africa witnessed a political landscape shift that led to the formation of a government of national unity. The African National Congress, ANC, lost its majority, thus partnering with opposition parties, including the Democratic Alliance DA and IFP, who object to the NHI policy. Despite this, Minister Motsoaledi maintained that the GNU Pact is not tantamount to an alliance and that any party opposed to government policies has the option to leave. Of paramount significance to South Africa's healthcare reform is the contentious Section 33 of the NHI Act, which aims to radically transform medical aid schemes. This legislation stipulates that, once the NHI is fully implemented, medical aids cannot cover any services paid for by the NHI, substantially narrowing their scope to auxiliary services not defined in the Act. Motsoaledi declared Section 33 to be instrumental, comparing its potential removal to constructing a house without a foundation. The minister did acknowledge the possibility of amending the NHI Act, referencing the inevitability of legislation evolving over time. Additionally, the Department of Health is beefing up its legal defenses in anticipation of litigations in response to the NHI, signaling readiness to support the legislation or concede to critiques based on judicial findings. Unlike his stance on the legislation's foundational elements, Motsoaledi was less forthcoming regarding the financial implications of the NHI. The health minister downplayed the necessity for further roadshows and consultations, flagging them as responses to stakeholder demands rather than government-driven initiatives. He criticized the media and industry voices, particularly targeting claims from entities like Momentum Health regarding the astronomical costs of the NHI, which he called hooliganism. As the country monitors how healthcare financing will evolve under this new legislation, the collective gaze turns towards the realization of universal healthcare, the alterations to the business-as-usual mentality of private medical schemes, and the political agility needed to navigate the reforms democratically. Thank you for choosing Satori News.